Every year, smoking claims the lives of over 8 million people worldwide. Among these, more than 7 million deaths are directly linked to smoking, while around 1.2 million are the result of non-smokers being exposed to secondhand smoke. With such staggering numbers, it is undeniable that cigarettes are not just a personal choice, but a pervasive threat to global health. Today, we're diving into a critical topic. How do cigarettes affect the body? Despite their widespread use, cigarettes pose significant risks to our health. Let's explore the profound impact smoking has on our bodies, from the respiratory system to our overall well-being. First and foremost, smoking has a profound impact on the respiratory system. Inhalation of cigarette smoke exposes the lungs to harmful chemicals, including tar, carbon monoxide, and various carcinogens. These substances damage the delicate tissues of the lungs, leading to inflammation, scarring, and reduced lung function. Smoking irritates the bronchial tubes, leading to inflammation and excess mucus production. This can cause chronic bronchitis, characterized by a persistent cough, chest congestion, and difficulty breathing. Smoking destroys the air sacs in the lungs, alveoli, responsible for exchanging oxygen and carbon dioxide. Over time, this damage leads to emphysema, a condition marked by shortness of breath, wheezing, and an increased susceptibility to respiratory infections. Smoking is the leading cause of lung cancer, accounting for the vast majority of cases. The carcinogens in cigarette smoke can trigger genetic mutations in lung cells, leading to the uncontrolled growth of tumors. It weakens the immune system's ability to fight off infections, making smokers more susceptible to respiratory illnesses such as pneumonia, influenza, and tuberculosis. For individuals with pre-existing respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD, smoking exacerbates symptoms and accelerates disease progression. It's not just smokers who are at risk. Secondhand smoke, which is the smoke exhaled by smokers and emitted from the burning end of cigarettes, also poses significant harm to the respiratory health of non-smokers, particularly children and individuals with respiratory conditions. Did you know that smoking has a profound and detrimental impact on the cardiovascular system, which includes the heart and blood vessels? Smoking is a major risk factor for various forms of heart disease, including coronary artery disease, which occurs when the arteries that supply blood to the heart become narrowed or blocked. The chemicals in cigarette smoke promote the formation of fatty plaques in the arteries, atherosclerosis, reducing blood flow to the heart and increasing the risk of heart attacks. It temporarily increases blood pressure and heart rate. Over time, this can contribute to the development of hypertension, high blood pressure, a leading risk factor for heart disease, stroke, and other cardiovascular complications. The chemicals in cigarette smoke damage the lining of blood vessels, endothelium, making them more prone to inflammation, constriction, and the formation of blood clots. This increases the risk of conditions such as peripheral artery disease, narrowing of the arteries in the limbs, stroke, and aneurysms, weakened and bulging blood vessel walls. Smoking significantly increases the risk of stroke, a condition that occurs when blood flow to the brain is interrupted or reduced. Smoking promotes the formation of blood clots and contributes to the narrowing of blood vessels in the brain, increasing the likelihood of ischemic strokes and hemorrhagic strokes. Carbon monoxide, a toxic gas found in cigarette smoke, binds to hemoglobin in the blood more readily than oxygen does. This reduces the blood's ability to carry oxygen to tissues and organs, putting additional strain on the heart and increasing the risk of complications. What's more, cigarette smoking is one of the most significant contributors to cancer worldwide. It's a leading cause of various cancers, including lung, throat, mouth, esophagus, bladder, pancreas, kidney, and cervix. The carcinogens and toxic substances in cigarette smoke can damage DNA, promote inflammation, and disrupt cellular processes, leading to the development of various types of cancer throughout the body. Quitting smoking significantly reduces the risk of cancer and improves overall health. Additionally, cigarette smoking weakens the immune system, making smokers more susceptible to infections and illnesses. Smoking compromises the body's ability to mount an effective immune response against pathogens, such as bacteria and viruses. This can lead to more frequent and severe infections, including respiratory infections like pneumonia and influenza. Smoking causes chronic inflammation throughout the body, which can contribute to various health problems, including autoimmune diseases and inflammatory conditions. Chronic inflammation can also impair immune function and make it more difficult for the body to fight off infections. Smoking can disrupt the function of immune cells, such as macrophages, neutrophils, and T cells, which play crucial roles in defending the body against pathogens. This can impair the body's ability to identify and destroy harmful invaders, leaving smokers more vulnerable to infections. But wait, there is more. Cigarette smoking can have significant effects on both male and female reproductive health. Smoking can impair sperm production, motility, and morphology, leading to reduced fertility. It's a risk factor for erectile dysfunction, making it difficult to achieve or maintain an erection. Smoking can disrupt hormone levels, including testosterone, which can further impact fertility and sexual function. It increases oxidative stress and DNA damage in sperm, which can lead to infertility and increase the risk of genetic abnormalities in offspring. Additionally, for women, smoking can disrupt menstrual cycles and hormone levels, leading to irregular periods and fertility issues. It can also impair ovarian function, reduce egg quality, and increase the time it takes to conceive. Women who smoke may experience menopause at an earlier age than non-smokers, which can further impact fertility and increase the risk of certain health conditions associated with menopause. Secondhand smoke can also affect reproductive health, increasing the risk of infertility, pregnancy complications, and adverse outcomes in offspring for both men and women. Smoking before conception or during pregnancy can have long-lasting effects on the health of offspring, including an increased risk of asthma, obesity, and behavioral problems. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Now let's discover how smoking accelerates the aging process and contributes to premature aging. Smoking deprives the skin of oxygen and essential nutrients by constricting blood vessels, leading to a dull complexion and an uneven skin tone. It also damages collagen and elastin fibers, which are crucial for maintaining skin elasticity and firmness. Over time, this can result in the formation of wrinkles, fine lines, and sagging skin, giving the appearance of premature aging. The chemicals in cigarette smoke, particularly nicotine, contribute to the breakdown of collagen and elastin in the skin. This weakens the skin's structure and makes it more prone to wrinkling, particularly around the eyes, mouth, and forehead. Smoking also reduces the skin's ability to repair itself from environmental damage, further exacerbating the appearance of wrinkles and fine lines. Smoking can cause skin discoloration and pigmentation changes, leading to the development of age spots, sunspots, and uneven skin tone. These changes are often more pronounced in smokers due to the cumulative effects of smoking on skin health. It also has been associated with an increased risk of hair loss and premature graying. The toxic chemicals in cigarette smoke can damage hair follicles and disrupt the hair growth cycle, leading to thinning hair and baldness over time. Moreover, smoking cigarettes has detrimental effects on oral health, affecting the teeth, gums, and overall oral hygiene. Smoking stains teeth due to the presence of tar and nicotine in cigarette smoke. Over time, tobacco use can lead to yellowing or brown discoloration of the teeth, which can be difficult to remove even with regular brushing and professional dental cleanings. It contributes to bad breath by leaving behind a lingering odor from tobacco smoke. Smoking can dry out the mouth and reduce saliva production, which increases the likelihood of bacteria buildup and unpleasant breath odor. Smoking is a significant risk factor for gum disease, periodontal disease, which can range from mild gingivitis to severe periodontitis. Tobacco use weakens the immune system and reduces blood flow to the gums, making it easier for bacteria to multiply and cause inflammation, infection, and gum tissue damage. Untreated gum disease can lead to tooth loss and other serious oral health problems. Smoking can diminish the sense of taste and smell by dulling the taste buds and olfactory receptors in the mouth and nose. This can affect enjoyment of food and beverages and may contribute to poor nutrition and weight loss. Lastly, cigarettes contain nicotine, a highly addictive substance that affects the body and brain. Nicotine rapidly crosses the blood-brain barrier and binds to nicotinic acetylcholine receptors in the brain. This stimulates the release of neurotransmitters such as dopamine, which are associated with feelings of pleasure and reward. Over time, repeated exposure to nicotine leads to changes in brain chemistry, reinforcing the desire to smoke and creating dependence. Nicotine is highly addictive, and regular smoking can lead to physical dependence on the drug. When nicotine levels in the body decrease, smokers may experience withdrawal symptoms such as irritability, anxiety, restlessness, difficulty concentrating, increased appetite, and intense cravings for nicotine. These withdrawal symptoms can make it challenging to quit smoking and contribute to continued tobacco use. Smoking becomes associated with certain activities, environments, emotions, and social situations. These behavioral cues can trigger cravings for cigarettes and contribute to the cycle of addiction. For example, smokers may crave cigarettes while drinking coffee, after a meal, or in social settings where smoking is common. So there you have it, folks. Next time you think about lighting up a cigarette, remember the toll it takes on your body. From your respiratory system to your cardiovascular health, skin, and even your mental well-being. Cigarettes leave no part of your body untouched. But here's the good news. Every puff you avoid is a step towards a healthier you. Quitting smoking isn't easy, but with determination, support, and the right resources, it's absolutely possible. Your body will thank you for it, and you'll be on your way to a brighter, smoke-free future. Remember, you've got this. Take care, and see you tomorrow in the next video. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.